Hi, I wanted to talk to you today about Narcan, Naloxone, and overdose reversal training. So what are the risks? Anyone whose drug use has been interrupted by 24 hours or more, anyone coming out of the prison systems, detox, hospitals, anyone who has a period of sobriety and then relapses are all at risk for overdose. Fatal overdoses occur when people are using alone, when Narcan and Naloxone is not available. What to look for? How do you know when somebody's overdosing? If you come across somebody who is purple, blue, extremely pale with a gurgling noise, the darker the skin of the individual, they're either going to go gray or ashy on you. Those individuals are in distress, they're not getting any oxygen, they need oxygen immediately. It is important that you immediately call 911. Keep in mind that calling 911 is safe. There is a Good Samaritan law now as part of the standing order that protects the person overdosing and the person calling from arrest. The idea is to make sure that the person who's overdosing survives. So call 911, administer the Narcan. You're gonna get a package. The package looks like this. When you go to open it, you turn it around, you peel the foil that's on the back off. You pull the product out, it's gonna look like this. Always remember, thumb at the bottom, fingers up top, bunny ear, quote unquote. Thumb goes in the bottom, fingers go around the nozzle. You're gonna put it into the nostril and you are gonna press. It instantly releases the medication. It's only gonna do one nostril and it's a done deal. It takes 5 to 8 minutes to kick in. You wanna then do rescue breaths. If the person is not breathing, the first thing you want to do is put your hand on their forehead, the other hand under the chin. You're going to tilt back. You're going to check in their mouth to make sure that nothing is obstructing their breathing. If it is, you have to turn them on their side, sweep it, and put them back. Make sure you have gloves on. If there's nothing obstructing, you got a face shield that looks like this. This actually is self-explanatory. The nose, just like it is going to go over top of the nose. You're going to pinch the nose. Again, you're going to tilt the head back to make sure that the airway is clear. And you're going to do 2 strong breaths every 5 seconds. 1 Mississippi through 5 Mississippi. Count it out. 2 more breaths. You will continue to do that until the person either starts to breathe, wakes up, or the ambulance gets to you. Again, you continue to do the rescue breaths. You will know once the person is starting to breathe because their color is going to come back. The minute that happens, even if the person doesn't completely wake up, you want to turn them on their side. You never want to leave somebody who's overdosed on their back, because if they throw up, they can asphyxiate on their vomit. If they wake up, you need to have that conversation with them and explain to them you administered Narcan, that their system will be blocked for 30 to 90 minutes, but it's only temporarily blocked. Narcan does not flush your system out. Once you explain that to them, let them know that when the Narcan wears off, there is a good possibility that whatever's left in their system, the effects are going to come back. If it's a large amount, they could go back into an overdose. It is important that somebody who overdoses and is administered Narcan, they should go with the ambulance. If they choose not to go with the ambulance, they need to stay among a populated area, among somebody that they know, and let them know that they had overdosed. In case they fall out again, then somebody will be there to respond.